Good morning everybody, Chris from the Headache and Pain Management Centre here for your Friday, and I thought today that there's a lot of questions coming through about the videos that I'm doing and also about the information that we're putting through. And today I will talk about the ways that we actually go about diagnosing, assessing, treating and getting people back on track. So it's all well and good to have all the information about different types of conditions, but it's actually really important now to explain how we actually get the results that we do. If you're there, say good morning and type it underneath. It's really good to have you with us again for this Friday. So, hey, we like to take a really sort of simple approach to physiotherapy here, a really simple approach to getting the results that we want to get for our patients. And I think it can at times be really complicated by some people, sort of making it a lot more difficult and a lot more complex than what it needs to be. And we've really just put together a process which I teach my staff and train them on, just to keep it really, really simple to get really good results for our patients with headaches and chronic pain. So the first thing that's really important is to make sure that you assess thoroughly. Okay, so assess thoroughly. So by assessing thoroughly, we've got 1 hour initial consults, which is it's not really that common through the physio profession at this stage. And at times we can actually have the 1 hour consults with a follow-up 1 hour consult as well, just to make sure that we get to the bottom of things. So having a really thorough assessment so we're able to diagnose what the problem actually is, and to diagnose what the main cause of what your pain is. And at times, the main cause of your pain may not be what you think it is. So it may not actually be, say if you've got a pain here in your shoulder, it may not be that muscle there that you're trying to poke at. It may well be a referred pain from a joint or something in your neck, or it may well be actually your brain looking to protect by pain before you even move, and I can explain that later on. But it can be a little bit different to what you think that it is. So it's really important to get to the bottom and assess thoroughly what the problem is in the first place. The second thing that we do is, and this is really important, okay, this is actually the most important step that a lot of people actually miss here. And the second step is to explain what's going on. Okay, so this sounds really simple and something that should be really done every time, but a lot of people, they come to see us not because they're in pain. They come to see us because they don't know why their pain's there, and they don't know what it is they can do about it. Okay, so they don't know why their pain is there and don't know what it is they can do about it. Now, this is not just for people that we're seeing for the very first time who've not seen anybody else. This is actually more common for people that have seen many different people over the years, sometimes 15 to 20, sometimes 30 or 40 different practitioners. And they've got this pain here and they've never actually had the cause or the root of their pain explained to them. So not just what's causing the pain, but actually how pain happens in the first place. Because we've got to remember that tissue damage and pain aren't related, and it's really important to understand how pain happens so that when you do go to step 3, it's actually really easy and much more effective to get there. So step 2 is explaining what the problem is in clear, simple English, so that you're able to understand what the issue actually is. And sometimes just explaining the issue can take a little while. Actually, can take a little bit of time to conceptualize and understand what the problem actually is. So that's step 2. So assess thoroughly and explain the issue. The third thing that we want to do is implement steps tailored to you to get your condition starting to go on the right track. So once we've actually diagnosed and assessed it, and then we've explained what's happening, we need to implement a plan, a really tailored individual plan just for you to get this actually on the right track. Because there's no point giving a recipe type arrangement here and actually get, just give out a generic thing, because look, everyone is different, everyone's pain is different, everyone's brains are different, so you can see patterns, you can see all different sorts of things that can happen with people and see common themes between people, but there's no point actually just going, you know what, here's this generic treatment plan, here's this generic thing that we're going to get you to do, because it just won't work. G'day Adrian, good to see you there, and good to see you there as well, Ange. Nice of you to join us. So when we're dealing with your condition, whatever it might be, it's really important to implement a plan of attack to actually get this pain under control. And that might take all sorts of manner of things, okay? So obviously explaining it is part of that, but getting the system starting to wind down to get you back to doing what you want to do. So that might take some early, just getting some joints moving, either with some exercise or some manual therapy. Sometimes some dry needling or trigger point releases are needed just to get things started off. For anyone who wants to start to criticise of my colleagues about manual therapy about that, you actually do need to get the joints going and get this system wound down sometimes before you actually get exercising and doing things. So just before anyone wants to have a crack at me about that. But patients know that you actually need to get some hands-on stuff first to get things going a lot of the time. Not all the time, but sometimes you just need to get that going. So basically the way that we like to treat is not to get you in every week for the rest of your days. Okay, it's actually to get the problem diagnosed first and put a plan in place so that basically we're getting you back to long-term relief. Not something that's just being managed or week to week to week to week without a plan. Oh, just come back next week, just come back next week. We're not about that. We're actually about getting a plan with the diagnosis that you've got, which is a long-term solution to get you out of your headaches and your chronic pain conditions. The last thing but not least, and this is the most important thing, is actually getting you to maintain those gains, both physically and mentally, to make sure that you can self-manage into the future. So obviously when you're in the rooms, we're getting the treatment going, we're using the Med-X machine, we're doing some work on your neck, we're doing some work with your back or your leg or your hip or your shoulder or whatever it might be. We're giving you some strength exercises to do, and we're really keeping on top of that for the first little while to make sure that you're doing them correctly and getting the most benefit. But the whole point of actually going to a physiotherapist who knows what they're doing and who is good at their job is not to actually become reliant on them. Okay, so you're not becoming reliant on chiropractic or physio or these sorts of things to keep you going. We're looking to get you to self-manage, okay, to give you all the tools and all the equipment to actually get you doing things day on day and to live your life confidently and calmly so that pain isn't such a burden anymore. So when we're giving you exercises to do and teaching you the exercises that you need to do, we're not the sort of clinic who actually just sits down and goes, you know what, do these exercises, they'll be really good for you, because a lot of the time people don't do their exercises, they hate them, they're boring. So we work with you to actually work out what the best exercises for you to do are based on your environment, based on your conditions. We had a lovely man who came in from just down the street recently who's not really well off, who doesn't have a lot of equipment, can't afford a gym membership, can't do anything like that. So we just gave him a really simple exercise program to do at home. And it can be just as simple as getting up and sitting down off a chair, because that's a squat, doing some back curl exercises to get some movement into your back. We can do really simple things. Or if you're looking to do something more, if you like, complex, or something more high level, like a few of the high level athletes that we see here as well, we can tailor a program to that as well and work with professionals around the place, whether they be exercise physiologists, dietitians, psychologists, whatever it might be, to get the best result for you long term. So we're looking to get the best results for you long term. We're not looking to do short term things, quick fixes. We're not looking to see you every week for the rest of your life. We're looking to get you back on track in a short period of time. It takes about, let's say 6 weeks to 12 weeks to get things really, really going for someone with a chronic condition. And then we're looking to actually get you to self-manage after that with some strength work and also some really important mental stuff as well, to make sure that you know why your pain's there, that you know that if pain comes back, it's not something that is a really nasty thing that's going to be there forever. Everyone gets pain. It's not there to be to really frightened of it. We need to make sure that you're confident and certain and strong when you're doing these sorts of things, okay? So that's the 4-step process. So the first one is to assess thoroughly. So really get in, assess and diagnose on that first day. Take an hour, take an extra session if you need to get to the bottom of it before you even do anything else, okay? The second thing that you need to do is to make sure that you explain what the issue is in plain English, because if you don't know what the problem is, there's going to be fear, anxiety, even sometimes depression about wondering what the hell is going on with your body, okay? So it's really important that we have that process going, that you explain, that you understand what's going on first. Okay. The third thing, we implement a whole swathe of treatment techniques to get things going. Okay, so whether that's exercise, education, manual therapy, a combination of all of it to get things starting off for that first 6 to 12 weeks to make sure that things are actually starting to go on. And then the fourth and most important one is to make sure that you're self-managing, okay? That we've got a plan in place to make sure that you're able to manage these things going forward so that you're able to do the things that you want to do without the fear and the anxiety of getting that migraine, getting that headache, getting that back pain and not being able to do the things that you want to do. So, hey, I hope that explains our 4-step process, and basically that's just how we go with every single patient, okay? So everyone is different, everyone has different conditions, everyone has different circumstances, but if you follow that 4-step process where you assess, explain, treat, and self-manage, that it can't really go wrong. It's really quite simple, and you've got to do all of those steps in order before you actually get anywhere and get the relief that you kind of need. G'day Belinda, good to see you there. Nice of you to join me. So that's the 4 things. If you want any more information about how we go about things, I've actually written a short ebook about how to choose the right health professional for you, how to choose the right health professional for you. So if you'd like a copy of that ebook, please type in below ebook and I'll send you that ebook to you. It's a 17-page ebook about what should actually happen when you see a physiotherapist, chiropractor, or any health professional to get the best result for your pain condition. So type in below ebook if you'd like a copy of that, and feel free to tag anyone or like, share, comment underneath who might find this video useful. Hey, I hope you have a good Friday and a good weekend. I'll be back early next week with another video here. It's nice of you to join me once again, and I will see you again soon. Thanks very much. Bye for now.